let's talk about healthcare. The healthcare reform bill passed the House 220 to 215 on a Saturday. And many are already being critical that it's too small a majority. It shouldn't count. We shouldn't be making such a big reform with only a five-vote majority. Of course, the rules are the rules. Where were those people when Al Gore had won the popular vote but lost the electoral vote to George W. Bush in 2000s? Those are the rules, right? It doesn't matter if you win the electoral vote or the popular vote if you lose the electoral. And it doesn't matter if you only have a 5-vote victory in the House. The rules are the rules. Now, one of the biggest controversies that came up is this Stupak amendment. This is the amendment, if you haven't heard, that would prohibit federal dollars from being used to buy any insurance policy offered through this exchange that is going to be created that covers abortions other than those related to rape, incest, or danger to the mother's life. That means if it's been 6 weeks into a pregnancy and there is no verifiable danger to the mother's life, and it's not a case of rape or incest, you would not be able to have a covered abortion with this Stupak amendment. It would also require health insurers that offered elective abortion coverage through the exchange to offer the exact same policy in every respect, except that it doesn't cover abortions.
So this was part of the bill?
This was an amendment. And so many Congress folks voted for this, including Richard Neal, right here in Massachusetts, in our district in Massachusetts. He voted to add this amendment to the House healthcare bill. The same argument applies to the Stupak amendment. The Stupak language would require women seeking coverage of elective abortions through the exchange to sign up for a separate policy, potentially forcing them to spend more for the two than they would have spent on a single plan that included abortion coverage. It's undeniable, Lewis, that the amendment threatens the availability of insurance coverage for elective abortions for the working poor and lower middle class. These are the people that would receive subsidies under the House bill to buy insurance. And of course, if the policies purchased through the exchange have these limits, this is an amendment that is going to disproportionately affect lower income individuals. And of course, who are the individuals that most need access to a safe abortion?
The ones being denied it.
The ones that would be denied it.
Right.
Exactly. That's absolutely right. And we've talked multiple times on this show, making legal, safe abortions, legal, affordable, safe abortions more difficult to obtain does not reduce the number of abortions. It simply reduces the number of safe abortions.
Which puts the mothers at risk.
That's exactly right. And we know that as a result of not having access to a safe abortion, there are, I think, if I remember correctly, 71,000 hospitalizations or deaths of women who choose to go forward with unsafe abortions. So very clearly, if this is made part of the final bill that eventually passes, we don't know if it will be or not. If this amendment, if this restriction on legal, safe abortions being covered by insurance is kept in, we are not going to reduce the number of abortions. We are going to increase the number of women who die as a result of not being able to afford a safe, legal abortion.
But I don't think that evidence is going to, research is going to change the mind of anyone who voted in favor of this amendment.
Well, we'll see. We'll see. I think you're probably right. I think that the way that this is going to not be part of the final healthcare bill is going to be because Senate Democrats and all of the Democrats, once we go into conference on this bill, are just going to say that it's not going to be part of the bill. And hopefully with the majority they have, they'll be able to keep it out. One comment that I saw on the internet related to this amendment said, is it really so much to ask people to use their own money to kill their unborn children? Why does anyone think they have a right to use money confiscated from the American taxpayers, to pay for this atrocity? So here's a situation. You're a 50-year-old woman who's barely making it financially. We could find millions of people in that situation. You have no plans to get pregnant, but you do. Because you're 50, the baby is very likely to be severely deformed, maybe even unable to live if it's born. And the same woman did not spend any extra money to buy one of these supplemental abortion plans that the Stupak Amendment says you would require. She's out of luck if she can't afford to pay out of pocket for an abortion. and the baby could be born. It could die within days. It's very likely that it will be extremely deformed, not have a high chance of survival. This hasn't even come up, and that's the exact scenario. Forget about all of the low-income, young pregnancies and all of those that are, often the target of abstinence-only education and so on and so forth. What about the people like this 50-year-old woman who just simply can't afford to pay for an abortion? Abortion is a legal procedure. To demand that a woman pay for a rider separately to cover a legal medical procedure is wrong, and it seems discriminatory. If you disagree that abortion should be legal, that's a separate argument. And then you can fight that in the courts, and you can see about getting Roe versus Wade overturned. You can fight that any way you want. But as of right now, it is a legal procedure. Late-term abortion, certain states have barred that. There is legislation limiting late-term abortion. But abortion is a legal procedure.
I think, this is just such a crazy topic. I mean, if you're someone who believes against, is pro-life, and you believe that by having an abortion, you are, killing an unborn baby, why not just leave it alone? Let whoever wants to have abortions, and they can get judged in the next life, if that's what you believe.
Well,
I mean, it's just...
This is why that wouldn't work, because people would say,
I know it's
no,
not going to happen.
It's our duty to do what we can while we're alive.
Right. But, it's now impossible to separate church and state.
It's becoming more and more difficult.
It's impossible.